So my name is Doug Mathisen. I'm the Chief of Thoracic Surgery at the Massachusetts General Hospital in Boston. I'm currently the Deputy Editor for Policy for the Annals of Thoracic Surgery. I've been on the editorial board cumulatively over 10 years, having served with Tom Ferguson when he was the editor, and in my current role I served a year with Hank Edmonds and now with Alec Patterson. The area that I've been given responsibility for is a new initiative of Alec Patterson's. It's to develop a forum for health policy related issues. Health policy is an important activity of our society. It has not really been represented in the annals in the past, and this is an attempt to give a forum for all of the activities that occur within our specialty through the Society of Thoracic Surgeons Washington office. The important trends and why this new initiative of Dr. Patterson's is so important is that, in my opinion, we're at a pivotal point in healthcare. We've seen it about every decade or every 2 decades where there's been some important change in healthcare policy, reimbursement, and this one is amongst the most important transition periods, I think, in my lifetime in being involved in surgery. Changes in health policy come at a dizzying rate. Every week or month seems to bring some new change. The Accountable Care Act has had a profound impact on medicine. Health policy issues are changing and evolving and affect our members, whether they're aware of it or not, on a regular basis. So having a forum for health policy and changes that occur in Washington that directly impact both the regulatory side of what we do as surgeons and the payment side as practicing physicians will be a great service, I think, to our members. I think there are a lot of exciting things going on in cardiothoracic surgery, and I think it's what makes our specialty still so appealing to those who practice it and those who are considering a career in cardiothoracic surgery. It's a broad, diverse specialty with new developments every year, certainly emphasized by the annual meeting. The trend to less invasive surgery, both in cardiac surgery, thoracic surgery, and congenital heart surgery, probably is the thing which has evolved and taken place over the last 5 years, and to me has had the greatest impact on how we practice cardiothoracic surgery. Well, the Annals of Thoracic Surgery is a great forum for young investigators, young surgeons wanting to develop an academic career. I believe it's the cardiothoracic journal that has the widest distribution, the widest readership. It has one of, if not the highest, impact factor in cardiothoracic journals. And so it's a great forum for young surgeons trying to establish their credentials in academic medicine. If a person has never submitted a manuscript, there's a lot of advice to be given. First of all, ask for help from your senior colleagues. Read the instructions to authors very carefully. Put it together in the method, in the form that is recommended by the Annals. That'll save you a lot of editorial work at the end. And I think it's always a good practice that once you have finished the manuscript, read it as if you've been asked to review that manuscript, and be certain that all of the points you're trying to get across are covered in your manuscript. If there's information that you see is lacking and you can easily get it, add it. So those would be the main recommendations or suggestions I would give for new authors. Well, like so many cardiothoracic surgeons, I was influenced by mentors. I was fortunate to have great role models, cardiothoracic surgeons who I could identify with, and I think that's what certainly made the specialty so appealing to me. Once I became interested in cardiothoracic surgery, it was obvious that it had a little bit of everything if you wish to practice the specialty in the broadest sense. I was somebody who was struggling with the notion of giving any kind of surgery up. I enjoyed all aspects of surgery. And when I thought about it, cardiothoracic surgery allowed me really to operate from the neck to the pelvis. And I thought this was its most appealing aspect of it, in addition to the introduction and the important influence of mentors. Certainly as I've progressed in my career, you start to think what you'll do when your career is done. My pipe dream has always been to attend classes and essentially go back to college. I had the great benefit of, through the Society of Thoracic Surgeons Kennedy School of Government course some years ago, to participate in that 10-day course. It was one of the best things I ever did. And by being introduced to the Kennedy School of Government, I've always thought that I would love to go back and take a class, go to the lecture series, and also maybe go back to college. Being in the Harvard Medical School, Harvard College system, there is a whole spectrum of things that are available to you that you could do once you've retired. So I'd like to go back and fill in some of the gaps that I missed maybe in college, and something I would look forward to.